Moyo wangu umeinama, umechoka sababu ya machozi. Macho yangu yamefura, yanawasha sababu ya machozi. Machozi yangu yamekuwa chakula changu siku na mchana. Nakuita baba njoo, baba njoo unifute macho.
Mimi nikija hapa hospice nikipewa kaunga naonaga ni kama mamangu amefufuka, amempatia chakula.
You have been very, very helpful. I am very happy. You have done a lot for my dad. You have done really a lot. I have never seen such good people.
Wabereri niliku kumalirea daumireje nuru ili dawa ciao ni njega.
For a long period of time, there's been a puzzle of solving the hospices and palliative riddle. Many infected and affected have been suffering, but the question that arises, who will save them?
Wakaniandikia mandawa, 1,500, 2,000, 3,000, nikashinda na kununua. Nikinunua hii, nikashinda na kununua ile nyingine. Nikakaa bila ndawa, nikakaa bila kunywa ndawa. Alafu ugonjwa ukasindi.
Kitu cha kwanza baada ya kujua kwamba mimi niko na magonjwa ya kansa, wakati mapema sikukuwa na ule ufahamu, kwa sababu nilikuwa nimeona ni kama wakati wangu wa mwisho umefika, ni kama sasa mimi maisha yangu hayatakuwa tena.
Hii ugonjwa ilinianza kama nafanya kazi ya nyumba lunga. Zile hospitali za kule hazikujua ni nini, walikuwa wanadhani ni matende. Tambo niletwe Coast General 208 ilikuwa imeenda. Nikajaribu kupewa dawa. Mmoja alisema atanunulia, akanunulia moja. Hakunipa ya pili. Sasa ikarudi na nguvu. Ile kukaa nayo na kwenda kliniki za hapa. Kuna hii Catholic ilinisaidia na Vincristin na Blomizing. Ilifanya kutuliza. Ilitulia, alafu sasa ndio ikainuka tena, wakaona wameshindwa, wakanituma Coast Hospice.
And this is why we are behind the hidden smile. Registered in 2005, Kenya Hospices and Palliative Care Association, Kehpca, has been on the forefront to partner, educate and advocating palliative care to all.
We work together and see whether we can create partnerships and networks that can assist patients in need, and we already have had one of the needs. So we'll do our best, and Kehpca will continue to exist to do our best to be advocate for patients with palliative care needs.
Dr. Zipora Ali is the Executive Director, Kehpca.
Kenya Hospice and Palliative Care Association is, actually we say Kehpca in short, is an organization that actually advocates for palliative care across Kenya. And our main, what we really do is do a lot of advocacy at policy level, at training level, at the public level, and and also work with other stakeholders who are also interested in palliative care to bring palliative care to the level where it should be. So palliative care is care that's given to patients with life-threatening illnesses. Sometimes we say life-limiting, and even sometimes we include, of course, patients with terminal illnesses. These are patients who have got mostly incurable diseases, and are going to either be living with disease for a long time and will need a lot of support, whether it's physical support to address the symptoms. For example, cancer has got a lot of pain. Most of cancer patients will have a lot of pain, and that pain needs very special medications to be able to control it. But it's not just about the physical symptoms. We also support the psychological, social, emotional, spiritual, and sometimes in financial issues that patients are facing.
It is quite evident that terminal disease patients have been suffering all over the world. We decided to visit Meru Hospice Center and try to understand what is on the ground. We are then taken to a home of a beneficiary of this program. We arrive in the home of Janet Kanini.
Where we are at one of our patients. She's Janet Kanini. Janet Kanini is 52 years with adenoid cystic carcinoma of the hand, and she enrolled with us early 2016, but she was diagnosed in 2015. She has attended so many hospitals, but she was referred to us by one of the patients that we had taken care of, and she came to us in a lot of pain, and we enrolled her. We started her on treatment. She was also depressed. We gave her psychosocial and emotional support, and we have always been doing that. And due to the pain, after assessing the pain, we started her on high dose of morphine. And she has been on high dose of morphine, and at the moment she is taking 20 milligram 4 hourly. And then we also have other drugs that accompany morphine.
She explains the struggles that she has been undergoing until Meru Hospice came in.
Nikienda Kenyatta Hospital nikaambiwa nitolewa kakitu kapelekwe kwa kipimi, kapimwa kaonekane ni ugonjwa gani. Nikasema nitatolewa. Nikaenda kutolewa, akaniambia mama, hatutolei wa leo, tunatoa wanjana. Wewe enda nyumbani, utakuja kesho kutwa. Ila kesho kutwa nikaenda. Wakaniambia hatutoi wanjana, tunatoa wa leo. Wewe enda, utakuja tarehe 17 mwezi hiyo mwingine. Alafu nikaishiwa na kuenda. Nikakosa pesa ya gharama, nikakaa nikakimya basi. Alafu nikawa na usungu tu mwingi, usungu, ninahangaika na usungu na kuumwa na sikio, niangalie ni nini, kunjifuna. Alafu nikaamka nikaenda hapo hospitali. Huyo mama akaniambia, daktari akaniambia, wacha nikuandikie, kuna watu wanakuja hapo Meru Hospice, uende utawaona na watakusaidia.
There is always a headache of finances to treat this disease.
We were using or spending a lot of money. The money was not there. You can see that the family is not that well up. Each and every one of us has his or her own family, and as the sons, and we are taking care of them. And we were brought up in, I cannot call it that poor family, but it was not a very well up family. So we didn't have the funds for the medicine for our dad.
Nilikuwa na pesa, kansa ikamaliza pesa. Sina mtu wa kunisaidia.
The same applies to other hospice patients, like Mary Wanjiku Mungai in the Coast region and Mzee Maina from Nyeri.
Nilipoenda kwa social worker Kenyatta, nikamwambia mimi nimelemewa, nimeishiwa, na mimi huku sina relative Nairobi. Wakaniwave na 7,000. Nikamaliza ile radiation. Sasa nilipomaliza ile radiation, ndio huu mguu ulivimba, ukapasuka hapa hivi. Wakati nikichomwa juu ulipasuka huku. Litoa lengelenge ikapasuka kama vile kuchomeka na maji ya moto. Sasa ikawa kutembea ni shida. Kutoka River Road mpaka Kencom kwa gari za Kenyatta nilikuwa nachukua hata 40 minutes. Nilijikaza hivyo nikamaliza ile radiation. After radiation nikaenda clinic tena, wakaniambia nafaa nipewe chemotherapy. Nikawa sina uwezo.
The money which was required even for the injection, when I went to the chemist, I was told that he would be spending, or that injection costs around 17,000 every month. I went to one of the chemists, and that is when me and some of my other brothers, Mr. Washira and Geshoi, we became so confused. We didn't know what to do. We didn't have any direction.
On the other hand, the hospices have been coming in to save the less fortunate.
Hii chakula mnapokea mkijua mepitia mkononi yetu, we are custodian, we need tunampatia. So may the Lord bless these people who actually give this food to you. Abarikiwe sana. Mwambie.
The pain that the patients go through is a bitter piece of the hospices. Life is so different from other people.
This is the blanket.
That is the naona ile kagideda anafikiria ni uchafu ile yake na mudunga
utiza nyanya sio tuko gahura na gutire kendo gahura tena na cha deswo na dihota ubi naku na goko gahura daikara ninge maga merire ngawetwo niwe ndethecirwo muno riu ndigitida ngitaya.
Even though I am a palliative care nurse, I also have that human feeling in myself. Of course it is painful, but sometimes you have to let go because we know they have been through a hard time.
Neglection too has taken a deeper root in this matter.
Mimi ni mtu ambao nilikuwa na familia, mke na wake, mke mmoja na watoto wawili. Tulipata naye watoto wawili, lakini baada ya kujua ya kwamba nilikuwa nimeathirika na magonjwa ya kansa, aliweza kutoroka, aliweza kuenda.
Nikaja nikawaeleza dada zangu, lakini dada zangu ilifika mahali wakachoka. Kwanza walipoona mguu umepasuka wakaniuliza, sasa sisi tuadhani utakuja umepona umerudi hata uwezi. Kaambia uwezi jua mimi nina mwili wangu umeendanaje na ile mashini. Kawai sasa yafaa nikawaambia kila baada ya wiki 2 natakikana Nairobi. Wakasema hiyo hatuwezi. Wakaja wakanikalisha chini wakaniambia, wewe utajipanga na safari zako za Kenyatta. Sisi hatuwezi hiyo wiki 2, kila baada ya wiki 2 Nairobi hatuwezi. Sisi wenyewe tuna shida zetu. Na ukiwa Nairobi na shida zako za Kenyatta usipige simu. Ilifika hapo nilishtuka. Na kushtuka ni sawa kwa sababu hiyo ndio hali wagonjwa wa saratani wanapitia. Wakati unasema una saratani wanajua basi wewe wafa wewe. Nilidhani kanisa na familia ndio itanisaidia. Lakini kanisa ilinitenga, hiyo ndo kitu nilishtuka.
There are some of the patients with talents, but because of their conditions, their talents are diminishing.
Upendo na amani, upendo na amani, upendo na amani.
Akaniambia barua
Some of the patients are even abused because of their situation.
Yako awachane na kesi ya shamba. Nikamwambia mtoto hauzikani na shamba, mimi siuzikani na shamba. Nisaidie na barua nisomeshe mtoto. Alistuka ndio anipige. Na mimi naye unajua hii mkono haina nguvu. Na mimi sasa nikajikinga na left. Unaona? Tukingangana tu hivyo yani kwetu ni kwa jia tu. Watu wakaingilia hiyo maneno. Akakuja wakaamua. Akasema barua hata nipatia mpaka shamba ikata. Wanipea barua yao ya kukata shamba. Mimi nilishindwa nikaenda kwa headman. Headman anatukana na ndugu yangu. Nikienda kwa chief anatukanwa. Kuingia kwa ndio akacommand chief aniandikia barua niende Bagathi Hospital. Ndio nipewe duplicate. Nilipopewa hiyo barua kuenda huko kwa record kupatia Wambua barua, alisoma akaniambia kama huyu haja kufa siwezi kukupatia barua.
Huyu dadangu alikuwa na tabia kunitukana. Amwambia wewe tuna lawyer wetu wa kansa, ile siku utanitukana utaenda ulizwa na kushtaki.
Joseph Luther, a legal practitioner at the High Court of Mombasa, has volunteered to advocate and educate patients on their rights. He has helped the patient with free legal services. Joseph Luther expounds more on legal matters.
Subsequently, he informed me that these people also have legal issues. They struggle with issues both in their personal and in their professional lives. So it is then that I offer to support in offering free legal advice, at least as part of giving back to society, but also as part of learning on their part, learning the challenges that they go through in their daily lives. It is then that I discovered that indeed part of palliative care is not that the health aspect, there is the legal aspect, which is mostly overlooked.
I underwent what the surgeons call craniotomy, that is surgery of the head. Around February 2013, I was taken to theater after I was diagnosed with a small growth inside my head, just like what they call the brain. They also advised me that even when you are not sick, you need to reorganize yourself, even in terms of what we call writing wills. Many people die even in accident and they die intestate. So even when you are not sick, it is important to organize yourself in a way that even if you went today, you would not leave problems behind, particularly where you have a wife and children.
Started in 1995, Nyeri Hospice offers palliative care to patients to help them lead a quality life with no symptoms. There is also a legal clinic that offers patients with legal services. Sarafina Gishohi, the Chief Executive Officer, Nyeri Hospice, expounds on this.
One of the services we offer is a legal aid clinic, whereby the patients come here and they are educated on legal issues. And this really helps the patients and their families so that they are able to prepare for death, because death is an eventuality. And it is important that the patient dies without any unfinished businesses. In the legal aid clinic, we are able to educate them on writing a will, about succession and inheritance, and generally about deciding who will take care of their property and who will take care of the children once they are gone.
John Githinji, a social worker at Nyeri Hospice, gives details on support of this care.
All the services in the hospices and the palliative care units are standardized, and you can receive equal care whether you are in Nyeri or wherever you are. Secondly, I would like to request the government, the national and the county governments, to come in and assist all the hospices and the palliative care units with the drugs and also the other non-pharmaceutical materials which they require, because the patients are suffering, those who have stomachs, they are suffering due to lack of colostomy bags. We would like them to come in a big way so that they can be able to contribute and also give financial assistance and material assistance to the patient, to the hospices, so that the patients can have these gadgets.
Sasa nashukuru Mungu kwa sababu ya uponyaji na nasema asanti kwa sababu hata dawa vizuri umepewa.
The spiritual part being a significant aspect too, the clergy also comes in to offer spiritual support and guidance to the patients.
Since I have been a friend of Hospice for quite some time, I felt the Spirit of God leading me to go and ask for work at Hospice. And when I came, actually I came and I met that they were looking for a chaplain. The day I came, I met that even there was a letter that had come that they sent somebody for training. Kehpca wanted to train somebody. And when I came and I met the letter, I thought I was in the plan of God, and I thought it was God's will.
The community now is being educated that terminal disease can affect anyone. It has no social class, age nor gender, and it is the responsibility of every individual to come and join hands to fight this war.
I would love to ask all the stakeholders in the health sector and the government and the Ministry of Health and all those who are concerned about the health situation in our country to improve the cancer treatment in the country by establishing state-of-the-art cancer centers. It is devastating when, let's say, someone has been diagnosed with cancer from Marsabit County and they are referred to Kehpca National Hospital, but due to the backlog, they are told to wait for 3 years to commence radiotherapy treatment, as if the cancer will wait for those 3 years. It is sad because most patients die even before they can get the treatment, because one comes to Nairobi with cancer stage 1, but because they have to wait for the 3 years, they are told now the cancer is in stage 4, and they are told nothing much can be done. Some of them don't even live to get to that point of commencing treatment. If we can have all these centers set up all over the country, then many people will not have to die. We will reduce greatly the number of people that succumb to cancer.
You should not get discouraged, you should not panic, you should journey together until the end. Let us join together so that we can fight this battle.
And I want to emphasize that it's not only for the adults, it's also for the children. Palliative care is also for children who might have these diseases and need to be supported during their illness. And of course, it's not just for the poor, it's for everybody. Anybody who has a devastating disease, a life-threatening illness will benefit from palliative care. There are not very many people in palliative care. For example, here we are quite a few people, and we have to really stress ourselves to reach all parts of the country. So we need to encourage more people to become interested in palliative care, to become champions in palliative care, and to be able to provide services for patients.
Lack of public awareness, limited budgetary allocation towards palliative care by the government, healthcare professional attitude and lack of knowledge, legal frameworks and policies which have dropped down the operation of this organization, hence not reaching all patients with these challenges.
Like I said earlier on, it has not really taken up in the government system. For example, you find that the government doesn't have a budget for palliative care. And so that is a challenge, because what we've done so far, we've done a lot of training in hospitals, trained healthcare providers, trained people who can actually take up the challenge and provide services to patients. But we've had to look for funding to do this training. We've had to go and look for funding out there, and we've been very lucky so far. Although now the funding has gone down, really gone down. We have had Open Society Foundations come in, American Cancer Society, TET, Tropical Health Education Trust, Hospice Care Kenya, the former Diana Princess of Wales Memorial Fund, the African Palliative Care Association, our twin Hospice and Community Care of Lancaster have really been supportive in trying to help us make palliative care available to everybody in Kenya. But we would like to see more funding from within our community, because this is about our patients, this is about people who we care about, our own. We need to really get a lot of support within our country. I think people need to understand, we always say that palliative care is everyone's business. It's not my business only, it's not the business of the Americans or the British, it's the business of everybody in this country.
We come to meet the 86-year-old Mzee Ntaimura Ntwinzere from Ruiru Rwarare from Meru Hospice, who was diagnosed with the cancer of the stomach in 2005, who has also benefited from the organization. He rides for approximately 30 kilometers to reach the hospice.
Mimi nakuja na baiskeli. Safari inakuwa kilomita 30.
The organization has a mission to promote and support acceptable, accessible and affordable quality palliative care for individuals and families by creating networks of informed and empowered institutions in Kenya, and also to reach the marginalized areas. All this is because of a vision to have a quality palliative care for all in Kenya. Globally, over 40 million patients each year need palliative care, and less than 10% of the people receive it. 80% of people lack adequate access to medication for treatment of moderate severe pain. In Kenya, through initiative by Kehpca and other stakeholders, palliative care services have been integrated in 25 counties to date, and more support is needed to move Kenya from preliminary to advanced integration phase. We all have a stake in this responsibility of seeing a better life for humanity. Let's join hands and create a smile to these souls. A fight to save an ailing soul. And this is why we are behind the hidden smile. Behind the hidden smile.